congratulations, it's a boy. Or, congratulations, it's a girl. In 20 years, nearly 20 years as a practicing pediatrician, that's often how my patient relationships started. Our bodies declare our biological sex. Biological sex is not assigned. Biological sex is imprinted by our DNA at the moment of conception, and it's in every single cell of our bodies. Human sexuality is binary. You either have a functioning Y chromosome and will develop into a male, or you do not, and you will develop into a female. Identity is not biological. Identity has to do with our thinking and our feelings. Thoughts and feelings are not hardwired before birth. They develop over time. Our thoughts and feelings, our self-perceptions may be factually correct, or they could be factually wrong. And I'll give you some examples. And within these examples, you're going to understand or come to see fact versus ideology. If I were to walk into my physician's office today and say, "Hi, Dr. So-and-so, I'm Margaret Thatcher," my physician is going to look at me and diagnose me as having a delusion, give me an antipsychotic, and send me to a therapist. If I walk up to that same physician and say, "I am a man," my physician will say, "Congratulations, you're transgender." There is no blood test, there is no imaging, there is no confirmatory way to diagnose transgender except from the person's word. Take the person's word for it. Because identity is not in the body, it is in our thinking. Another example, if I go to my physician and say, "I am so anxious, so depressed, I'm suicidal some days, I am an amputee trapped in a normal body," I will be diagnosed with body identity integrity disorder. If I go to the same physician and say, "I'm a man, please refer me to a breast surgeon for a double mastectomy," my physician is expected to do so. So, most, not all medical organizations, but most mainstream medical and psychological organizations essentially say if a patient walks into you wanting to have a healthy arm or leg removed, they're mentally ill. But if a healthy patient, biologically normal and healthy patient walks in and wants their breasts or a penis removed, they are transgender, and don't you dare tell them anything differently, because that's discrimination. No one is born with hardwired thoughts and feelings. No one is predetermined before birth to be transgender. We know this scientifically by looking at twin studies. Any trait that is set, biologically set, prior to birth will be found in identical twins 100% of the time. So if you have a trait that is only determined solely by, let's say, prenatal hormones changing the brain, by DNA altering the person, that's going to be found in identical twins 100% of the time, meaning that if you have an identical twin who's transgender, his identical or hers identical twin should also be transgender. This is not the case. In studies, the majority of transgender twins were found to differ significantly. All right. Dr. A.Cretella, why should we believe you? Can you give us an example? Yes, I can. We're not saying these children with this thought process should be ignored. I had a patient, we'll call him Andy. This was a good 10 years ago. Between the ages of 3 and 5, little Andy increasingly played with girl toys, stereotypical girl toys. He really made friends more easily with girls, and he started telling his parents, "Mommy, Daddy, I am a girl." I referred the family to a therapist. Now, the therapist's focus was basically to understand Andy and his family's story, to look at those family dynamics, because oftentimes, sometimes with mental illness in children, it may be due to mental illness in a parent or both parents. It may be due to child abuse, but often children are misperceiving just what may be benign family dynamics. Couple months, it's hard work. Therapy is hard work. But during one session, they had a breakthrough. Andy had a truck and a Barbie. He put the truck down. He looked up at his parents and said, "Mommy and Daddy, you don't love me when I'm a boy." Now the therapist had something to work with. These parents were great parents. They were super parents. But when Andy was 3, he went from being an only child to having a sister born with special needs. The mom and dad were great parents, but his sister needed a whole lot of care and attention. And Andy internalized, and not every child would internalize this way, but for Andy, he did. Mommy and Daddy love girls. If I want them to love me like they did before, I have to be a girl. It's not conscious. It's all subconscious. Now, here's what would happen today. Today, Andy's pediatrician would refer Andy and his family to gender specialists or a gender clinic. The parents would immediately be told, this is who Andy is. Why? Because here's how you diagnose a transgender child. The child must consistently, persistently insist that they are not their biological sex. Bingo, done. You were born this way. Parents, you must socially transition your child, change his name to a girl's name, and ensure everyone else treats him as a her. Because if you don't, he will grow up to commit suicide. The experts work with the family, the school system, and shepherd this child along in this confusion until they approach puberty, at which point, now we must put you on puberty blockers. Because if we don't block your physical development, your child will become very anxious and depressed as the facts of their biology develop. So we want to block them, arrest this development so that we can give the child more time to think. Now, mind you, puberty blockers also arrest brain development, but you want them to think more clearly. Now, what the experts don't share with the family is this is an off-label use. It's not FDA approved. And by the way, when we use the puberty blocker, Lupron, to treat prostate cancer in adult men, it's associated with memory problems. And we found similar findings when the Lupron is used to treat certain gynecological issues in women, adult women. We've never had long-term studies on puberty blockers being used in biologically normal children. This is experimentation. So they start with the puberty blockers, and this physically isolates the child because what's happening to their friends around them? Their peers are growing up. They're being more psychosocially isolated as their peers develop along the normal pubertal trajectory, and they do not. So, we must put them on the cross-sex hormones. What are the risks of cross-sex hormones? So a boy, Andy, would be put on estrogen. If it were a little girl, her cross-sex hormone would be testosterone. These are serious drugs. They, over the lifetime, raise your risk, cardiovascular disease, so cardiac, stroke, diabetes, various cancers. These are not benign medications. And they also can cause depression, anxiety. I thought that's what we wanted to treat. This is the standard of care now. It is not supported by science. It's ideology. And it gets worse. If you're dealing with a biological girl who is convinced she is male, once that girl, age 15, if she's age 15 and she has been on testosterone daily for a full year, her physician may clear her for a double mastectomy. I want you to understand the ideological disparity here. The American Academy of Pediatrics, which is the mainstream pediatric group, just came out with a report encouraging pediatricians to talk to their teenage patients about tattoos and encourage your adolescent patients to really talk with their parents, because tattoos can be, well, you better consider them permanent, and they can scar. This same AAP is 110% behind a 16-year-old girl getting a double mastectomy. They aren't concerned about the increasing numbers of young adult women who are coming out online, because that's the only place they will not be disparaged and harassed. Young women coming out online saying, my physicians and therapists shepherded us along this path. They transitioned us to male. We now have no breasts. We are sterile because puberty blockers plus the cross-sex hormones in young children prevent the testes and the ovaries from maturing, permanent sterility results. So they're waking up at age 28 or so and saying, oh my gosh, what was done to me? There's another area I'd like us to consider, and I will wrap up. This is being taught from preschool through grad school, although it started from the top and has filtered down. The other side is very fond of saying 3-year-olds know if they're a boy or a girl. It's no trouble, no danger whatsoever exposing them to transgender picture books. What the experts are not saying is, yes, most 3-year-olds can correctly identify themselves as girls and boys, but there are many children age 7 and under who do not understand that sex is constant, stable, and permanent. There are many children ages 7 and under who believe, you know what, if a boy puts a dress on and says, call me Daisy, I think he did change sex. I think he did become a girl. And this is why we had in Rockland, California, some of you may be aware, one little girl who had there was a coming out ceremony for one of her 5-year-old male classmates the last day of kindergarten. She went home and completely melted down after getting out of the bathtub, telling her mom, look, mommy, look, am I turning into a boy? Joey turned into a girl. I don't want to turn into a boy. This is why the confusion is there. This is why it is psychologically damaging to young children in preschool and in our school system to tell them the lie that some people are trapped in the wrong body. You could be trapped in the wrong body. We are undermining their reality testing from preschool forward. If they can't trust their physical bodies to tell them who they are and what they are, who or what can a child trust? And that's what we're talking about.